My name is Jennifer with Team Select Home Care Services, and I'm going to go over what services we provide, what private duty nursing is, and what insurances cover it, as well as how to contact us. So let me just share my screen so I can put up my PowerPoint. Oops. Sec. All right, can you see that?
Yes.
Okay, perfect.
Yeah, great.
All righty. Why is this not going? Okay, there we go. So private duty nursing or shift care nursing is one-on-one with a nurse, typically in the home. So a licensed vocational nurse or a registered nurse. And usually it's about 8 to 16 hours a day, although we do have patients that can get up to 24/7 coverage. But the difference really being versus like traditional home health, instead of it being an hour visit, we're there for a duration or extended hours, such as 8 to 24 hours. And it is covered by insurance, which I know a lot of people are unaware of. So we're kind of going to dive into that pretty deeply today. So before that, the duties of the nurse, they pretty much do anything and everything that you would do for your loved one in the home during the time that they're there. So that would include all daily living activities like bathing, toileting, grooming, light housework or like cleaning as it relates to the patient. So like changing of sheets or cleaning of syringes, all of that kind of stuff, as well as clinical duties such as medication administration, G-tube care, vent care, trach care, any breathing treatments, monitoring for changes in status, and again, pretty much anything and everything that you would do for them during the time that they're there, whether that's morning, afternoon, or overnight. So insurance coverage, the two main funders that we work with are commercial insurances such as Anthem, Blue Cross, Blue Shield, Aetna, United, and that can be either HMO or PPO we've worked with to get coverage. And then the other big insurance one that we're going to go over is Medi-Cal. So a lot of people think of Medi-Cal as an insurance that people have if they're below a certain income, but we actually use Medi-Cal quite a lot, and we help a lot of our members get enrolled in Medi-Cal through the HCBA Waiver, which stands for Home and Community-Based Alternatives. So it's basically a waiver through Medi-Cal that was created so that people could have an alternative to skilled nursing facility care and get benefits and keep their members at home. So again, think of this. Oh, sorry, Keith, what was that?
Super.
Yeah, so a lot of people think of it as like I have to be below a certain income level, and so a lot of people just don't apply for this, or they'll apply for just Medi-Cal and not the waiver and get denied. So how we do when we enroll is we submit both applications together. So we submit the regular basic standard Medi-Cal application, and then we also submit this HCBA waiver application. And so the HCBA waiver, an important difference is it really is looking at the medical needs of the patient, not just the income. You do have to be approved for both. And so a lot of times what will happen when you submit both of them is you might potentially have a share of costs, which I want to mention. They'll go over all that, Medi-Cal will, when they enroll you, but there is a process that we can go through that a lot of times helps get that share of cost reduced or getting rid of altogether, called the spousal impoverishment. So if you're married, then you're able to go through this process. And just kind of an example of one patient that we worked with ALS in Orange County. The wife, the patient had a pension, the wife worked, they had assets. They were still able to get Medi-Cal benefits. They did have a share of cost. They got it reduced a little bit, but they still had a share of cost. However, that share of cost was still much less than what they would have paid for nursing services. So they still move forward. In other instances, though, we have been able to get the share of cost removed altogether. And a lot of times too, people are thinking, do I have to move all my income or assets around or deplete them? And for most people, that's not the case. So usually I would just say, I would encourage get that submitted and see what happens. And then if for whatever reason there is a large share of costs that we can't get rid of, then you can move forward with like a financial advisor or something like that. But most of the time when I submit those applications myself, there might be a share of costs, a slight share of cost, but we can get it reduced. So I definitely just encourage people to submit the applications and see what happens and move forward from there, because Medi-Cal does cover anywhere from 40 hours a week to sometimes 168 hours a week or around the clock coverage. So it really is a great coverage option for patients because it is a substantial amount of hours per week and it's continuous. So as long as you have the feeding tube or as long as you basically need that care, Medi-Cal continues to cover. Like commercial insurance, a lot of times they have like a certain amount of hours. And to go back to commercial insurance, basically we would take the policy number and call in and check what the benefits are and go over that with you. So sometimes it can be a set amount of hours per calendar year, which again, we can go over. But in regards to Medi-Cal, the only downside, like I said, it is a great coverage option and you can get it even if you do have income and assets. The only downside is it takes a long time to get approved and through the process. So on average, it can take anywhere from 2 to 3 months, sometimes even more than that. So I definitely encourage people, like I said, to submit it as soon as possible. A lot of times I'll say submit that as soon as you know that you're potentially going to get a feeding tube. Although, especially in San Diego County, we have a lot of patients that don't have any medical needs like a G tube that just need help in the home, and they're able to get quite a lot of hours through Medi-Cal. So I would say for anyone really that is looking for support in the home to get those applications submitted and just see what happens. I'll pause if anyone has questions so far. And then our offices, obviously we have a Carlsbad office that covers all of San Diego County. We do have several other locations, but that Carlsbad office would be the one that services you guys. And then the best way to get in touch is just to reach out to me via cell phone. You can either call or text me. I can forward my email as well. It's jeward, WARD @tshc.com. So either email or by phone. And again, we would look into either if you have commercial insurance benefits, we can call in and I can get that information to you in terms of what it covers, or I can help and assist and get those Medi-Cal applications processed and hopefully get coverage that way. Yeah, that's it. Keith, did you have anything else that you wanted me to go over at all today?
Well, no, that is excellent. And hang on to your chair because you're going to get calls and emails.
Sounds good. Yeah.
Yeah. Just to our listening audience, to manage expectations, I think it's fair to say from 40,000 feet that without the waiver and not qualifying for Medi-Cal, you're not going to get this funding. Is that fairly accurate?
Wait, say that one more time.
You know, without the waiver and without qualifying for full Medi-Cal, either through a trust or just because of your situation, there's not a lot of funding available. So it's a narrow pipeline. And I just don't want people to hear this and think, oh, I'm going to get help or I'm going to get, because they might not, right?
Yes, correct. So like, I mean, we are able to get most people covered through Medi-Cal. The only thing is that it's such a slow process. Like it takes months and months. I mean, 2 to 3 is really the minimum amount of time it takes. And then I didn't really give any maximum time because it just varies. But I mean, it could take 5 months. It could take 6 months. I know that's a long time for a lot of people to wait. Although that's why I say submit those applications as soon as possible. So I would say for like ALS chapters that we've worked with in other areas, most people that we submit Medi-Cal applications for do get covered. It just when they get covered varies greatly. Like it's definitely takes a really long time. And then besides Medi-Cal though, yeah, that's like really the only coverage option. There are commercial insurances and they do honestly cover. However, for example, like you said, to manage expectations, Blue Cross and Blue Shield on average usually authorizes 400 hours a year. So it sounds like a lot, but in reality, so it's good to start off with, and then submit Medi-Cal. It might give you a little reprieve while you wait for Medi-Cal, but depending on how many hours you use, I mean, that exhausts and runs out in like 2 months. So you might be looking at like another 4 months until you get Medi-Cal. So we have a patient here who has Blue Cross Blue Shield. They cover 200 hours per year. So he uses it for our services twice a week for 4 hours is what we do. They're still waiting for Medi-Cal. So to manage expectations, they had a couple documents that they've been having. The husband works full time, so he's been having trouble like getting him over and responding to calls quickly. So we've had to like restart the process for him, but he's going on a year of waiting for Medi-Cal. So it definitely takes a while. It's a process. Like I said, it's a great coverage option, which is why I say like the sooner you can start the process, the better. But yeah, it can take a while. And then besides that, insurance benefits are very limited. I might provide you some support, which is better than nothing, but it's definitely limited.
Okay. So I have two more. One scenario or one question is like, all right, I just got diagnosed. I'm handling most of my activities of daily living, but given how long it takes and knowing what my neurologist said is coming, either I'm losing my hands and arms or my feet, or, you know, it's different for different people. Right. Is it, when do I contact you? What's the right time?
Yeah, so usually I get contacted when there's starting to be a decline in like a decline in some sort of function. So it's typically like when they start being less independent, maybe it's before they get the G2, but it's usually there has been some decline is when I get the call. Although just from what we're seeing in terms of how slow the process is, I would say the sooner the better. Like, let's get the application submitted before you have that decline. The only thing is it's kind of like a fine line there, because if they get their assessment done and they don't have a decline, then they're going to get access at a very low amount of hours. But right. On average, it always takes about 2 to 3 months. Usually assessment takes at least a month. So I would say just to do it as soon as possible, because you can always resubmit for another assessment. So like, let's say you called me right about the diagnosis. I don't have any decline yet. So we submit the applications. Medi-Cal comes out to process you and does your assessment, and they don't really give you much support. You can always ask for a reassessment later on down the line to get more hours.
Okay. So just understanding that sooner is better.
Yes.
And if you're fortunate enough to have a slow progression, it's a blessing, and we can always reassess later.
Exactly. Yeah. Okay. Because on the flip side is like, then you need it now, and you really don't have time to wait. You need help now in the home, and you're looking at a 6-month wait period. I mean, that just is an extremely long time. So like, that's really the downfall is like, yeah, this is great. What a great program. It has so many hours available. But I mean, when you really need help in the home, 6 months is the killer time frame. And that's just too long to wait when you need help now. So that's the huge downfall of the program.
Okay. So I've got another scenario. The spouse is pretty much the caregiver. She hires with her own money a caregiver for, let's say, 40 hours a week. And she's been doing this for years. So aside from running out of money, which at some point will happen,
right?
But the short-term need is, how do we give her a week to go collect herself and get a break? Is there anything in any of these programs that would address that, or is that a respite program through other sources?
Yeah, like, I mean, in terms of like, from my knowledge, like the programs that we work, it's more like a respite situation. So like, you probably would be best with like a caregiving company or a companion company and doing like just a respite for a week, because really the type of program that we do is more long-term. So like, it's really hard for us to staff, especially with like just staffing difficulties that we're seeing with COVID. It's really hard to staff just a week. Obviously, I know that's a need for the family, but there's not really, to my knowledge, any set program through Medi-Cal that deals with that. I know the VA does have a respite program for that, but yeah, through Medi-Cal, no. Although you did touch upon something to bring up too, because I know a lot of families have caregivers in place that they're already paying that they really like, and that works well. So through this waiver program, in addition to being eligible for nursing services, there's also a couple of programs. There's IHSS, which I'm sure some people are familiar with. And then there's also the WPCS program. So basically, if you have somebody that you're already paying for caregiving services, once you're enrolled in this program, you can get those people enrolled through IHSS and WPCS to provide hours instead of having for the family to pay out of pocket.
Okay. No, that's helpful. Just wanted to get that out there so people kind of understand.
Yeah.
And, you know, the best thing to do, like in that case, is get this program going to reduce the number of hours that are private pay.
Exactly.
Yeah. And then, you know, deal with it going forward. So.
Exactly.
All right. Yeah. And so this is probably unfair. How many AOS families are you working with in like Orange County? Do you have a rough idea? Is it?
Yeah. So, so like currently on services right now, I think we have about 4. We probably have another like 10 going through the pipeline in terms of Medi-Cal applications. And then we've worked with, I mean, multiple families in the past as well.
Okay. No, that's terrific. We really appreciate it.
Of course.
And what did I not ask that I should have, or did we kind of cover this fairly good until they talk to you?
I feel like we've covered it pretty well. I mean, the main thing is in terms of either of those options of coverage is just like either let me call in the benefits and just check and see, or just submit the applications. I mean, the worst that's going to happen is there's no coverage, or, you know, you're waiting for a long time, but it's a resource at least to check out, I would say, because, you know, it's better than the alternative, which is having no resources. So.
Right. Which is, yeah, more common.
Yeah.
And then, so for your company, you cover basically Southern California and more. I mean, you guys are.
Yes, correct. Yeah. So California, we have we cover all San Diego County, all Orange County, LA County, as well as Riverside and San Bernardino. So we work with this chapter, obviously, we work with the Orange County chapter, as well as the Golden West chapter out in LA and the Inland Empire area. That's our California offices. And then we also have offices in, I think, 10 other states right now.
Okay. And how far east do you go? Do you cover El Centro and Yuma, or not quite that far out?
We do cover it, although it is difficult. So I believe it is a part of our coverage territory, but it is a little bit challenging. So it's something that we can look into if anyone does need care out there.
Okay. Yeah, then we have a few families. Just wanted to let them know it's still okay to contact you and see what can be done.
Exactly.
Okay.
Yeah. And even if I can't find staff, I can still help them get Medi-Cal. So.
Okay.
Yeah. I remember living in San Diego, that was always the challenge area. I had a previous agency out in San Diego, so I'm still sort of familiar with the areas.
Sure. Well, Jennifer, this has been extremely helpful.
I'm so glad.
It cuts it right to the chase. It lets people know. Just talk to you, you know?
Exactly.
Throw it out there and see where it lands, and understand and know up front it's going to be a process.
Exactly.
So patience is kind of the key word. Which is tough in our world because everything is urgent, you know, from a 40,000 foot view. But, you know, if you hang in there for a few months or even 6 months, it can be really helpful.
Exactly. Yeah. I hope everyone found this helpful, and definitely feel free to reach out if you guys have any questions, and thanks for having us, Keith.
Okay.